Yeah, yeah, okay, good. All right, so now, what you do is you get the iliac crest right here and follow it around, follow it around, follow it around, until you come right here and you'll feel the PSIS, okay? And they're little tubercles, come over here.
Yes.
You feel it? Okay, you feel it?
Here. Yeah.
No, right here. See, you were right in the dimple, right here. You feel that?
Is it above the dimple?
It's below the dimples. Actually, they say the dimples is the marking for it, and it should be right around there.
Right
But if
there?
you really feel it's just below the dimples, okay? All right? Do- What?
Is this it right
Right here.
now?
You feel it?
Nope. We don't get the arm.
Okay, all right? All right, so that's where the PSIS is. Now, just medial to it, you should feel some depressions, 2 depressions. They're approximately 0.7 chung from the PSIS. That's your your sacral foramen. And we know that the PSIS is bladder 28. Okay, that's bladder 28. And the sacral foramen, you have sacral foramen 1, which would be bladder 31, sacral foramen 2, which is bladder 32. So think of the number of the foramen, and that's where you are, okay? So if you're at 28 here, just medial to it, you'll feel 2 little depressions. And people, you're not going to fall into a hole, all right? Even though it is a hole, on many people, because there's a massive gluteus muscle there, okay? You don't really feel, it's just a very mild depression. Actually, Elizabeth has good ones. So feel that.
Level, I'm sorry?
It's 28, it's 32, 20, easy. You're too tall, I could feel the difference, easy.
What's the level? The four?
The whole, you feel that depression? Okay.
What is the level though? Is S?
It's PSIS.
Oh, PSI.
PSIS is 28, is bladder 28, and just medial to it, about 0.5, 0.7 chung, is bladder 32, which is the second sacral foramen. You didn't feel it?
32? You said 31.
Jason, you
31
didn't-
is the first.
the first one.
First.
Yeah, each sacral foramen is 31, 32, 33, 34, okay? So, but 32 right across from the PSIS, all right? All right, so that's a good, now, when you needle these you go through these foramen, okay, when you're doing the needling. So if you remember, the sacrum is a convexity, right? It's a convexity, it's part of the second, it's part of the primary curve of the body, right? Which is the other primary curve? Thorax, right, because that also has a convexity, all right? That is a kyphosis, which is a convexity, okay? So you're on this kind of an angle. So if, say, for instance, this is your PSIS, this knuckle right here. So you're talking right in here is going to be your second sacral foramen, all right? So you're going to be needling on an angle like this to get in. And for the first one, you're going to be even more like this. Do you see what I'm saying? Because you're on an angle, you're on a convexity. So to get into that 31, you're going to go like this. 32, you're going to go more like this. Then 33 will be more like that, and 34. So you'll be on an angle following that convexity to get into the foramen. Okay? So now, all right, so here's her PSIS, all right? Now, what I would like you to learn to palpate, here's your PSI up, right up here is your sacral base and your L5 S1 disc right in here, okay? So we want to start counting, and I want you to learn to count just the way I asked you to count from the from T7, all right? I want you to learn to count from this way too, all right? Now, I know the books say that this here is L4. It varies, okay? I mean, for my topical course, because the book we were using was L4, but I've read a few books and they all have different, there's variance, which stands to reason because you're shorter than him, he's taller than you, she's shorter and more petite, you know, and so forth and so on. So there's going to be variations. So what I have found is that you have variations of L4, you have variations of L4, L5 disc, you have variations of L4, L3 disc. All right, so L4 being the spinous process of L4. But if you have somebody that has extra large vertebra, you're gonna get onto the L5, L4 disc as opposed to the actual spinous process, all right? So one of the things I want you to try to find out tonight with a lot of the different, I want you to palpate each other and figure out what is their iliac crest level, all right? Because this will help you to see if you can see the differences, all right? So, the first thing, as I said, you do, take knife edge, go in here, and you come around and down, and you'll feel that crest. Now, another thing, with men, their iliac crests are more horizontal and thinner, or small, narrower, okay? Woman's iliac crest is wider and more broader, all right? Why? Because of childbearing, all right? So when you go for a male iliac crest, see, the women's iliac crest very often is right at the waist. The men might be up higher. So I want you also to start, and everybody, try the women, try the men, because this is the only time you're going to get to see. You're going to see a difference, all right? So I want you to get used to that difference, all right? So, all right. So here, on her, now on her, it appears that she probably has it at L4, L3, no, L5, L5, L4 disc, where her iliac crests are coming across. All right, here's a spinous process of L4. Here's the disc right here. And again, feel for the little troph or that little depression. And very often it's very small and you could hardly feel it, all right? But you've got to feel for that because that's what you're counting. All right, you're counting the interspinous space. And what vertebra is that interspinous space named for?
Below.
The one above it, apparently, the same thing as the ribs. It's named for that interspinous space is named for the vertebra above it, or the spinous process above it, okay? All right, so that's that. So now, what else did I want to tell? So I want you to start counting, so find the PSIS, then come up, and you should find, and it should be very, very apparent to you that you're at the base of the sacrum and L5, the connection L5, S1 disc, okay? Because, again, look, there's like a difference in the angle right here, and you kind of fall into it, all right? And that's what you have to do. I believe that's bladder 26. I am not sure. It's either 26 or 27. I think it's 26, all right? Which is either large intestine or the back shoe point for large intestine or something like that. Could be bladder or large intestine, I don't know. I don't remember. 27.
No, small intestine.
It's 27 small intestine, but I believe 26 is right here, what I'm talking about, right where the L5 S1 disc is level. Is that it?
26 is,
Come on, think about it.
it's,
I can't remember. Maybe I'll try to look it up later.
oh no,
I can't.
26, that's the gateway for the shoe points, the shoe.
Okay, okay. All right. So anyhow, so start counting up then, all right? And try to find Mingmen, because that's a very important point also, right? Do 4, which is also bladder 23, 1.5 chung lateral, right? Bladder 52, another 1.5 chung lateral, okay? They all work for any kind of low back condition. I always do that, those two, okay, always. Anybody has knee problems, if I do their backs also, I always do those points also. And generally, people who are just fatigued and low, people who have sinking chi, people who have, you know, they're either having leakage problems or whatever, you want to get those kidney points, all right? So I want you to count up, and then I want you to count down and see if you're on the right, if you're counting properly, all right? Because in reality, people, the only thing I think that is actually true to form is T7. at the inferior angle. Because don't forget down here too, you could have what? Lumbarization and sacralization, which could throw you off.
So we need to know how to find the PSIS,
And then go up
and
about a
that's-
chunk,
That's
and,
where the L5.
and that should be where the L5S1 disc is, so that's the base of the sacrum, okay? And then I want you to count up from there, all right? So, go ahead, I'm sorry, I took over, but, and then, now you, do you have anything else to say?
There you go.
I did, I'm gonna keep on going, keep on going? All right, so I want you to do that. Then, where is she? There you are. You're gonna do the muscles, but I wanna turn you over supine. I don't want you sleeping right now. All right, people, another tender area is down here, right? We're talking about the pubic crest, right? So, again, I would tell all of my patients to keep their underwear on. There's no need, you can always pull things down lower, all right? And if you have to, what I do sometimes is I take this and pull it down and it holds it, all right? So do that. So now, we're talking about a very sensitive area again. What are we gonna do?
Use their
Anybody?
hand. Use
What?
their hand.
Talk to them after.
You're gonna definitely talk them through it, right? You have to let them know. You're gonna be in a sensitive area. Is it okay? I need this one point, it's CV2, all right? It's very good for bladder problems, okay? First of all, what do we have to have them do?
Use their
Pee
bathroom.
first.
Use the bathroom, evacuate. If you're gonna do CV2 or CV3, their bladder's gonna go up that way if it's full. Make sure they go to the bathroom first. Usually if somebody has bladder problems in terms of incontinence or whatever, they're usually older, and they go to the bathroom first anyhow before they start anything. So, but make sure that they're at the bathroom. Okay, so now, all right, so we talk to her and we say, listen, I have a sensitive area I'm gonna touch. It's in the pubic, it's in the more or less, just above the groin area, okay? And it's a very important point, it's gonna help you tremendously, okay? Is it okay if I go there?
Yes.
If you have a problem with that, I can use your hand first to find it. Is that okay?
Sure.
Okay, so then you palpate from the umbilicus, and you will feel through the hand where that pubis is. You can feel that, okay? Another way of doing it is taking your fingers like this, going to the umbilicus like this, and going down.
Oh, the heel.
And with the heel of your hand, and you can feel again that pubis. Now I'm gonna just replace that with my own fingers, is that okay? And that's what I do. And then you take your point and you do that. Men especially, please, make sure that you're very specific and very detailed in what you say to these people, all right? Because as I said in my clinical counseling class just last week, I found an acupuncturist in a newspaper that was being taken up on sexual charges. All right? So last week I talked about malpractice. Very important, all right? And I was shocked. I mean, it just came, and I said, well, I gotta show them this. Don't think you can get away with no malpractice. It's not that expensive. Be safe than sorry, all right? So, you know,
So a male doctor and a male patient, what's happened?
no, female. But that's why I'm saying for the males here, be careful. Most malpractice suits are not for damage, it's for sexual abuse, or what people are perceiving as sexual abuse. Most of the chiropractors out there, that's not that they're hurting them. Their malpractice is because they either came on to the patient, or they're touching them inappropriately, or they're not explaining what they're doing. I'll never forget, my sister-in-law called me up hysterical one day. She says, I went to my chiropractor, and he actually fondled my rectum. I says, what are you talking about? He says, well, he was pulling my coccyx out. There is a maneuver that a chiropractor can do that literally they go into the rectum and they pull the coccyx out, especially with pregnant women, and she was pregnant at the time, because their coccyx seems to go under and it causes a lot of pain. But he didn't explain himself, and he went in there and he pulled it out.
Yeah.
First of all, I wouldn't do it. I don't care what kind of a coccyx problem you have. I'm not going there. With gloves or without gloves, I'm not doing it. It's the same thing with do one. I will not go there. Why? Why would you try to do that? You're asking for trouble. I don't care how good that point is. There's 400 other friggin' points. You don't need it. Right? So I'm just forewarning you, and I'm telling you, all right? Do it, be very detailed in what you say to your patient. Make sure that you have their agreement. If they say no, you don't do it. Get away from that place. You might try explaining it a little more in detail why you're doing it. If they still say no, you don't do it. They have issues, and you don't want to touch those issues, whatever they may be. All right? As I said, there's so many other points. You'll work around it some other way. All right? So this is basically, that's one way. Now, another thing, with men, especially with prostates, there's a lot of liver points that are all up here in the upper thigh. I usually have my patients, when I'm doing a lot of leg points, bring shorts. Have them bring shorts. What I do with their gowns and their shorts is I'll get a little baggie. I'll put it in, keep it here, I'll keep it here. I have I'll have little bins that I'll put it in with their names on it, okay? So they don't have to bring it if they want to bring it every time, that's fine, whatever. But make sure that they bring shorts. Now the shorts you can work around because then you could like she's got shorts on, you could jack it up like that, okay, and get into those points. If they don't, what you could do is make shorts, right. Put it away and literally just go like this. All right? And then you have what to do. All right? So you can work around things like that. All right? The other thing, as I said, is make sure, I would get those Mylar sheets that I showed everybody in my class. It just gives them an amount of privacy and security. It also keeps them warm. Because when they have the acupuncture treatment, they tend to get cold, all right? Because you're moving the blood and chi. So have those Mylar sheets. They're very light. I reuse them all the time. I don't get new ones for each person. They last forever, okay? I found them at Target. They're not there anymore. I've been looking and looking and looking. They don't have them. It used to cost $1 for one of these little sheets. I mean, that's as long as, it's a body sheet, all right? So you got to go to camping places. You might try Walmart. You might try any of the Dick's. You might try whatever, okay, for that. All right, so again, be careful. All right, so now, do you want to do the ASIS?
It's okay.
So her ASIS is right here, okay? Here's, again, her iliac crest, her ASIS, all right? So now you want to touch the pubes, all right? It's right here. Again, also with men, with their genitals, if they hang left or they hang right, you got to be careful. So you try to look to see which side they were hanging to, and if they don't, you can also elevate their leg a little so it kind of falls down in the crevice, then you have no problems. Okay? Again, you want to ask them any problems with it. Give me your hands. We're going to palpate and see. All right, first, and then you can go. All right? Because there's a lot of important points in that area there. I mean, there's over here, you'd have, right around here, you have stomach 30, very good for ovarian problems, okay? You have, is it Zigong for infertility? I think that's an extra point. Also, it comes over here and then up a little, about one chunk over. All right, you have some spleen points here. I don't remember the number of the spleen point down here. So you got a lot of points for infertility especially. When I had a patient that I was treating for, I helped to get her pregnant, and then she came back to me, she wanted to get pregnant again, and she had a god-awful scar from the C-section she had gotten. It was very red, it was keloid-like, it was very elevated, and she herself said, it's very stiff down there. When I bend or I stretch or whatever, I feel pulling in there. So part of the infertility, we want to bring the chi, we want to bring the blood to the place. So I worked on the scar tissue while I was down there, and she felt tremendous relief with it. Unfortunately, the second time around, she didn't get pregnant the way she should have, but She was older, and it just didn't work that time. And she was another one that my infertility doctor says I gotta do it this, so she wasn't listening to me and allowing me to do my work, okay, the way it should be, which is, I tell all of them, I need at least 3 months. 3 months before you go to your infertility doctor, let me get you balanced, because then they jack them up on all these hormones. And let me tell you something, 3 months you could do a lot of work, they'll get pregnant on their own most of the time. So, whatever, but you gotta try to talk to these people, all right? All right, you wanna finish off? It's yours now.
It's yours.
No, I did enough, okay? Any questions so far with that, all right? So I want you to try to palpate the PSIS, try the ASIS. You'll be able to find, now where, you gotta go for the muscles, because then we have the AIS, and we could find that, right? Come over here. It's your turn.
I only know the adductor groups and the quadriceps. That's
All right,
the only one
well,
I know.
okay, well, you also did the pure force, but you know the sartorius, right? Where does the sartorius go to and from? The sartorius,
Sartorius?
yeah,
Yeah, that's where it attaches.
to the ASIS, all right? It attaches the ASIS, comes medially here to that aponeurosa, that's right in here on the tibial plateau, medial tibial plateau, all right? So this is what, very good. What triangle is up in this area? And what are the borders? Oh, you know me with
Inguinal
triangles.
ligament,
What?
Inguinal ligament,
Yeah,
the
right.
adductor, brevis longus.
Yeah.
And then the sartorius,
Yes, and what is that triangle?
femoral.
Yes, femoral triangle. Okay, that one you pulled out of the air. Okay, but, so because all we have in here is the femoral nerve and the vessels, the vein and the arteries, and then all the inguinal lymph glands are all in that area, okay? If you feel little bead-like lumps in that area, like kidney bean shape, that's your inguinal lymph nodes. That's indicating to you that there's some sort of infection in the lower jowl. Okay, so from here down, all right? So that's indicating to you, we could have a urinary tract infection, maybe bladder, mostly probably urinary tract, probably ovarian or some sort of maybe prostate condition going on, all right? So be aware of that, okay? Be aware of that, because that's gonna give you a clue as to what else is going on in that patient, all right? And again, what do? We move the blood in the chi, right? We also improve the immune system. So you want that to go to that area, so you might wanna have some points within that area, which might be liver or spleen points in that area, okay? What else was I, go ahead, go for it. What else do we have?
The quadriceps, well, she would have to be sitting up.
Okay, but
Go for it.
really, okay. For the hip, really, what you were giving us also were the thigh muscles, and that might have been my fault, because I didn't specify what I really wanted you to do, but you did the anterior thigh compartment, which probably the next people who are gonna be doing the knee is gonna go over again anyhow, all right? So what we really wanted was like the sartorius, as I said, okay? The rectus femoris, because that's the only other muscle that goes over two joints, right? It goes over the hip joint, it goes over the knee joint. So it extends the knee, it flexes the hip, all right? So does the sartorius. That's why it goes over the knee joint and goes over the hip joint. So that would have been more of what I wanted. Then turn to your side. Okay, so now what we have on the side, keep your legs together, girl. What we have on the side then is what? From the ASIS to the tubercle, to the iliac tubercle, is your tensa fasciae lata, which goes into then the iliotibial band, all right? And then after this, from here back, well, you have your gluteal maximus, which is primary. Underneath here would be your medius and minimus. And to do that, we would have to medially rotate, and you would feel it underneath the whatchamacallit. Also, you would feel the tensa fasciae lata if you medially rotate the leg, okay? The thigh muscles, actually. All right, turn over now, on your stomach. Now we're talking here, our gluteus medius, our gluteus maximus. So if she extends her leg, extend it, you'll feel the maximus, all right? Relax. Where does it attach into?
Not sure.
All right, well, it attaches into the iliotibial band, right? It attaches into the gluteal tuberosity, which is right down around here, which you should feel when she extend up. And you should feel, like right in here would be her tuberosity, all right? Okay? And lift up again. And right in here would be her iliotibial band, right along here, okay? Now, for the medius and the minimus, they medially rotate and adduct. So she should adduct, and you will feel it in here, or lay on her side. When she's on her side, let her abduct, excuse me, not adduct. No, adduct, right, adduct, adduct. You should feel it, so she should do that when she's laying on her side and bring her legs over the other leg, okay, you will feel that. Now, we've got the lateral rotators, okay, talk to me. It's your show now, I overdid my part.
That would be the piriformis, the obturator internus externus, the glomelli inferior superior, and the quadratus femoris.
Right, you really can't feel the glomelli, all right, so don't worry about it. Don't worry about the obturator internus. What I want you to feel for is the quadriceps femoris and for the piriformis, all right? Do we know how to get to the piriformis? All right, so find the sacrum and the coccyx, like this. Find the, bring your leg, abduct your leg a little. Right in there is your greater trochanter, okay, right there. As soon as you get that ridge by abduction, that's your trochanter, all right? So now you make a T, and that's right where your piriformis is. It's right in here, all right? And if she laterally rotates or brings her hip up, right, you should be able to feel it in here, all right? The glomelli, don't worry about. The quadriceps femoris comes off of the lateral part of the ischial tuberosity and goes into here also. So if she also, if she also laterally rotates, you'll feel it right in here, right here, okay? So I want you to try to palpate those, all right? And basically, that's it, all right? The main thing that I'm more interested in is you palpate the PSIS, get the foramen, feel the foramen, all right? Then I want you to ascertain whether their iliac crest is L4 spinous process, L4, L3 disc, or L4, L5 disc. Find the base, the sacral base, which is right at L5, L5S1 disc, okay, find that. I want you to count up then to T7 and see if you're counting properly, check yourself, okay? And then feel for these couple of muscles, and then you're good to go.